Throughout your career in healthcare, you will be required to wear a uniform. Your uniform helps portray a professional, trustworthy image to patients, whilst offering you protection and comfort throughout your work. So it is vital you get a uniform that fits well. When trying on your tunic for the first time, there are a few things that you will need to check to make sure the uniform is fitting correctly. The first thing to look at is the placket. This is a section of fabric that is covering the zip on the front. If your tunic is fitting well, the placket will be flat to the garment. If the tunic is too tight or too small, then the placket will be raised and not fully covering the zip. The second thing to consider is the rear action pleat, which you can find on the back of the tunic around your shoulder blades. In a well-fitting garment, this section should be closed and flat when you are in a standing position. If the tunic is too small, the pleats will be open and stretched. The third thing to check is the rear vent. This can be found at the bottom of the tunic at the back. If your garment is well fitted, then the rear vent will be lying flat. If the tunic is too small, the flap will be raised. You should also make sure you're able to fit your hands easily into your pockets. Another way to tell if your tunic is the right size and fit for you is by moving around and reaching forward. If you find it difficult to do these, then the tunic is too small for you and you will need a bigger size. Throughout your studies and work, you'll be reaching and moving around regularly, so it is important to have a uniform that is comfortable and easy to move in.